Welcome to this explainer on the veins of the female pelvis. You know, if you've ever stared at an anatomical diagram of the human circulatory system, it usually just looks like a chaotic bowl of blue and red spaghetti, right? Well, today, we're going to master female pelvic anatomy by mapping it out exactly like a massive transit system. We're talking major highways, local roads, and these incredibly complex roundabouts. So, let's dive right into it. First off, I really want you to imagine the sheer architectural marvel required here. I mean, how exactly does your body pull all that deoxygenated blood out of the lower half of your body, working against gravity, and then send it all the way back up to the heart? It's no small feat. It requires a highly complex network of drainage pipes and return highways just to keep all that traffic flowing smoothly.
Here's how we're going to break it down today. We'll start with the pelvic venous highway, move on to the lower abdomen and limbs, check out the gluteal and wall veins, look at the digestive and perineal routes, dive deep into the reproductive network, and finally, wrap up with some key takeaways.
Okay, part 1, the pelvic venous highway. Let's look at the major routes. So notice our three primary highways here. We have the external iliac vein, the internal iliac vein, and the common iliac vein. Basically, blood from the lower limbs and pelvic walls pools into the external and internal iliac veins. Then, those two join forces to become the common iliac vein, which eventually feeds right into the massive inferior vena cava. That's the grand interstate taking blood straight to the right atrium of the heart. Now, clinically speaking, these veins are highly variable from person to person. For pelvic surgeons, understanding these varied routes is absolutely critical for reducing surgical complications. But here's where it gets really interesting. Take a look at exactly where that merger happens. You can see the right and left common iliac veins uniting right around the 4th or 5th lumbar vertebra, so L4 or L5, to form that inferior vena cava. But consider this wild little fact. These massive, high-traffic veins typically lack valves entirely. Yeah, no way to stop backward flow. While most veins in your arms or legs rely heavily on valves to keep blood moving one way, this major junction usually doesn't have them at all. Moving on to part 2, the lower abdomen and limbs. This is all our incoming local traffic. Real quick, before we look at the specific veins, we need to cover a handy, beginner-friendly term, venae comitantes. This literally just means pairs of veins that closely accompany an artery of the exact same name. As we explore these local venous roads, you'll find they're incredibly easy to remember because they just copy the name of the artery they're traveling next to. Simple, right?
All right, check out the external iliac vein right here. This is essentially the main express lane coming up from the lower limbs. It's actually just the direct cranial continuation of the femoral vein. It starts just above the inguinal ligament and travels right up the pelvis, carrying all that deoxygenated blood from your legs and your lower anterior abdominal wall.
Now, just before it becomes the external iliac vein, it picks up some extra local traffic. You can see two key tributaries merging here. We've got the inferior epigastric vein on the medial side and the deep circumflex iliac vein on the lateral side. Together, these two basically act as the drainage system for your abdominal wall muscles, including your rectus abdominis, before they dump all that blood right into the main external iliac highway. Section 3. Gluteal and wall veins. Let's talk about the internal iliac system. I actually like to think of the internal iliac vein as the ultimate central hub of the pelvis. And just like the common iliac we talked about earlier, this vein is valveless. It's a short, wide blood vessel, and it is entirely responsible for draining the pelvic organs, the gluteal region, the perineum, and the external genitalia. It sits right above the greater sciatic foramen, collecting blood from a bunch of different branches before finally merging with the external iliac. Two of those major branches are the superior and inferior gluteal veins. As the names give away, these veins gather blood from your gluteal muscles, your buttocks, and your posterior thigh. They just slip right into the pelvic cavity through the sciatic foramina, above and below the piriformis muscle, delivering blood from the outside of your pelvis directly into that internal iliac hub. We've also got the obturator and lateral sacral veins to look at. The obturator veins do this really neat little loop, encircling the obturator foramen to drain the medial thigh muscles. Meanwhile, the lateral sacral veins are working the back end. They drain the sacral canal, which, very importantly, includes the coverings of your spinal cord. All of these local roads feed right back into that internal iliac system. Moving to part 4, digestive and perineal veins. Now, here is a super fascinating question for you. Normally, blood coming from your digestive tract has to go through the liver's portal system to get filtered, right? But which pelvic vein manages to completely skip the liver's filtration system entirely? Any guesses? The answer is the middle anorectal veins. You can see them highlighted here, draining the middle portion of the rectum. While veins higher up in the colon dutifully send their blood off to the liver, these middle anorectal veins drain directly into the systemic circulation via the internal iliac vein. That makes them a crucial port-systemic bridge. It's basically a direct shortcut back to the heart that completely bypasses the liver.
And we definitely can't forget the internal pudendal vein. This one is vital for the perineum and external genitalia. It carefully navigates a pathway called Alcock's Canal, picking up tributaries like the posterior labial veins and the vein of the bulb of the vestibule. So it's draining the labia and vestibular bulb before curving back around the ischial spine and into the pelvis.
Okay, part 5, the reproductive venous network. This is where we see some truly intricate intersections.
To really understand this area, you have to understand what a venous plexus is. Think of a venous plexus as a giant traffic roundabout. Instead of a single straight road, it's an extensive, interconnected network of thin-walled veins wrapping right around an organ. This setup is brilliant because it allows blood to constantly reroute and shift around the pelvic organs based on whatever pressure changes are happening.
First up in this network is the vesical venous plexus, which just beautifully wraps around the urinary bladder. It acts as a drainage net for the bladder walls, but it also physically connects with deeper veins, including the deep dorsal vein of the clitoris, funneling all that blood seamlessly back to the internal iliac vein. Next, we have the uterine venous plexus, sitting right along the sides of the uterus. Now, what's amazing about this specific plexus is its massive capacity. It is literally designed with thin walls so it can adapt to the immense increase in blood flow required during pregnancy. But there is a flip side. Because this plexus is so richly connected to other organs, it can unfortunately act as a sort of highway for spreading infections, malignancies, or even blood clots between pelvic organs.
Finally, we have the vaginal venous plexus. This is an incredibly dense network, especially around the lower portions of the vagina, and it interlocks heavily with both the uterine and vesical plexuses. Why? Well, because the body desperately needs a fail-safe, collateral return pathway. Even under intense pressure changes, like what happens during pregnancy or childbirth, this web ensures that the blood always finds a route back out.
All right, part 6. Let's lock in our key takeaways and review those connections. So here is the big picture. First, the major pelvic veins, like the common iliac, are often completely valveless highways. Second, they are highly variable, meaning surgeons have to map them out incredibly carefully for every single patient. And third, the organs of the pelvis are heavily interconnected via those plexuses. This allows blood to freely bypass blockages, but yes, it also means they share clinical risks. Understanding this transit system really demystifies how the lower body sustains itself. But the next time you look at an anatomical map, ask yourself this: how does a system with almost no valves manage such massive, gravity-defying pressure without failing every single day? It's pretty incredible to think about. If you found this visual breakdown helpful for mastering your anatomy, be sure to subscribe for more simple, structured medical explainers. Keep learning, and I'll catch you in the next one.